Hello, everyone. I am going to try this new thing where I try to provide a little bit of educational content through short little videos, and these are meant for learning purposes. They're basically to the best of my knowledge at this point in time. So if things change or if maybe I say something wrong, feel free to reach out. And I hope they're kind of fun. This is take 3. I am learning how to use technology. It's kind of hard. Okay, so this is a case that we saw a couple months ago, and I am kind of changing the details just to try and provide some learning points. So here we go. 3-year-old girl, and she is coming in with dysuria, frequency, and constipation. And the provider gets a UA, and the UA shows positive leukestrase and negative nitrites. Now, it's been forever since I was in med school, it feels like, and I forgot what these mean, so I'm going to share it with you, even though you guys probably know it. So the leukestrase indicate white blood cells, okay, or inflammation. And the nitrites indicate gram negative. That's kind of a generalization. So in her case, the leukestrase was positive, but the nitrites were negative. The provider started presumptive treatment with Augmentin times 7 days. Okay, so a few teaching points that I wanted to go over with you guys. Number 1, so consider wait to treat, okay? So in this situation, obviously I didn't see the patient, but it's, I would say, not always 100% that the patient has a urinary tract infection, so you can wait to treat. There are some guidelines on this that I will share with you. So here are some recommendations for basically empiric antibiotic therapy is if the patient has a history of UTI, which in this case we'll pretend that she didn't, okay? And then if there's evidence of bacteriuria without pyuria on dipstick, so that would mean if she was positive for nitrites but negative for leukestrase, and in our situation the opposite was true. So she had leukestrase and no nitrites, so that she doesn't meet that, she doesn't meet this. And then evidence of pyuria, so that would be leukestrase, provided alternative diagnosis have been excluded, so vulvovaginitis. So that's one that I want to come back to a little bit. The second point I want to make is the duration of antibiotic therapy, and also just kind of the definition of UTI. So the definition of a UTI in kids and adults too is greater than 100,000 CFU of an organism, as long as they're not immunocompromised or something like that. So in this situation, the urine culture actually came back with E. coli, and it was 50,000 CFU. Okay, so it didn't quite meet the actual definition of a urinary tract infection. However, in these cases, what I do is I call the parents, okay? Call the parents, call the patient, and see what's going on. If they're like getting way better, then okay, it was probably a urinary tract infection, right? If they're not better at all, then we probably need to stop antibiotics because there's probably an alternative diagnosis that's more likely. So I think when you're following up on labs, it's really important if you're like, what should I do? A lot of times the answer is call the patient. The other thing that I wanted to bring up is Intermountain has these really awesome guidelines for antibiotic duration, and we're always trying to use the shortest duration of antibiotics necessary. So in a UTI, so pediatric recommendations, okay, here UTI, greater than 2 years old, the antibiotic that is recommended to use is cephalexin, okay, and then the duration is 5 days. So after you call the patient, you can shorten the duration of the antibiotic. So you could tell them, oh, actually, you only need that Augmentin for 5 days instead of 7 days. And the other thing to think about is alternative diagnoses. So in kids, constipation is a huge cause of urinary frequency. So that could be definitely what's going on. And the other thing is vulvovaginal vaginitis, basically. So on Up to Date, there's this super awesome table on how to kind of coach parents on vulvovaginal hygiene measures. I think some of it's like that's super helpful is like soaking in clean water with no soap for 10 to 15 minutes and then soap just before you take them out of the bathtub and drying it completely. Sitting backwards on the toilet can be helpful for girls. So this table is super awesome, and I often just print it for parents to go over in clinic with them. Okay, so I hope you found this somewhat helpful, and I'd love some feedback. I also just wanted to end with sharing a great recipe that I've been eating lately. It's called curried coconut and red lentil soup. Super easy to make. You can make a big batch and freeze it. Good for lunches. And so if nothing else, if you'd like me to share the recipe with you, I'm happy to put some printed copies in the kind of folders at North Temple or send it to you via email. So I hope you all are well, and we'll see each other soon.